recording. There we go. Okay, so our topic today, welcome. We're going to go over some truly advanced ways of reducing our risk for cardiovascular disease, for heart attack, for stroke. Obviously, these are buzzwords because these conditions affect many folks around our globe and here in the United States of America and our sedentary, obese society that we live in. We don't want you to be a statistic, but it's very likely, though, based on the odds and what we are recognizing in public health measures, that you could be a statistic. I first want you to understand that there are many kinds of heart disease. A heart attack, for example, is only one specific type of heart disease. Heart failure is another type. The take-home message is that heart disease is the #1 cause of death, both in men and women, when we look at it statistically in the United States of America. Heart disease causes almost 25% of all deaths. That's about 1 in 4 people. And it is the biggest killer amongst our American citizens, more than all cancers combined. Remember that. That's pretty staggering, right? So many times, this is how Cherise used to think of cardiovascular disease. We think, how do we prevent this? Here's a heart attack. We get this image of a clogged artery kind of being like plumbing, like a big fat glug got into our blood vessels and clogged the blood supply to the heart. That's not really the case. Yes, there is a blockage of blood supply to the heart in the case of a heart attack, or to the brain in the case of a stroke, but it's not really what you think. It's not really this big glog of fat. It's rather a blood clot, which we're going to cover in the upcoming slides. So we look at a heart attack specifically. I don't want you guys to think of clogged plumbing, but rather more a volcanic eruption. That's a different kind of concept. So we're going to go in and understand what's going on in your blood vessels and why we might want to consider a heart attack more as an eruption. So bear with me, this is a little bit more complicated slide, and this will help us understand this a lot more. This is a diagram of what's going on in our blood vessels. So I want you to imagine a garden hose as a visual. So compare the garden hose to your own blood vessels. The structure is somewhat similar. You see those green cells on the top of the volcano, the things that look kind of like turtles on the top of the slide, those represent the inner layer of the garden hose, or the inner layer of the blood vessels. So again, you can see that kind of eruption looking thing going on the top. That's a blood clot. It's made up of numerous platelets and fibrous materials. Let me see, somebody else just said they wanted to come in. Great, we're good. We're good. At any rate, that eruption is made up of fibrous materials, platelets, and then underneath that volcano top, you can see the lipid core, which that's where it's comprised of cholesterol and some of the things that we're going to talk about in terms of prevention. Again, this is a symbol of volcanic eruption that we're trying to prevent. There's multiple factors. And here are actual slides of real life blood vessels. There's really 2 stages of a volcano, and this is pretty simple. It's either erupting or not erupting. The picture of no eruption on the left, we can see that the blood vessel looks like that garden hose. You can see that nice opening, and then to the left lower, you can see the lipid core sequestered away by that thick fibrous cap. That fibrous cap keeps the lipid core sequestered away and quote unquote safe. Our body wants it to stay there. Now with the eruption in the red on the right, you can see that the lipid core, and it's kind of nasty looking, isn't it? The lipid core has found its way out. The fibrous cap, you can look, it's much thinner. The lipid core has become more active. It erodes away that fibrous cap, which is, again, the inner layer of your garden hose. So then you see it spewing out. Also, there's things in the bloodstream that are going on as the blood goes through that garden hose or the vessels that can also wear away on that fibrous cap and lead to eruption. So you get this oozy leak through the inner layer of your garden hose or blood vessels, and that sets off a chain reaction, which you and I know better as inflammation. You guys have heard of that term before. Basically, A stable versus an unstable volcano is the same thing as a stable versus unstable plaque. That makes sense so far? Let me let some more folks in. Okay, so stable versus unstable plaque. So here again, many factors lead to eruption. When we think of cardiovascular disease or heart disease, think of it, it really means heart and vessel disease. And again, many factors lead to that final eruption. And we're here today to talk about power to find out more about your risk factors and which and what you can potentially, which and what of those that you can modify and work on. Again, it's a matter of understanding we have control over so many of these modifiable risk factors. And I want to empower you today. Central Drug wants to empower you today to work with your practitioner to learn more about your individual risk. Take home message, and I know you've caught this already, heart disease is preventable. And again, 1 out of 4 people here in the States dying of heart disease. It is absolutely crazy that we are doing such a poor job on something that's preventable. We do a terrible job in the United States of America addressing the root cause. And guess what the root cause is? Lifestyle. That's the depressing part of the talk. On one hand, it's empowering. On the other hand, hey guys, we need to look at changes we can make. Poor lifestyle, that indeed is the key. There are other things that we have been led to believe that are the most important thing, but they are not necessarily. We're kind of led in the United States of America, quick fix pharmaceutical. Let's think of a statin. If only it was that simple, right? It's not. Pharmaceuticals, prescription medicines can help, but the ultimate medicine we have is the ability of our body to fix itself if we do enough digging deeper, diving deeper, and giving our body what it needs. And of course, to not give it what it doesn't need or what it doesn't need to handle. So let's go look at some of these things. Life Simple 7. The American Heart Association, they developed a user-friendly graph. We will talk a lot about the circled thing you see on the upper right, cholesterol components. That's mainly what we're here for today. But there are many things on this chart that lead to the high unstable cholesterol situation. So things that we can take charge of, eating better. Obviously, we can move more. We can look at our activity level. I'm actually giving this presentation at one of those stand-up desks because sitting is the new smoking. We need to critically look, how much are we sitting in chairs? Okay, that's something I can modify. We need to lose weight, specifically losing belly fat. And now, common things in our modern society that we didn't have to think about years ago, we need to stop smoking. We all kind of know that one. Obviously, stop sitting, need to stand more, move more. And what I feel is the biggest contribution, and this is what we don't hear a lot about. We think cholesterol, 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 but the biggest contribution to inflammation is stress. And we need to work on stress management. Too much stress, not managing it appropriately, that contributes to poor behaviors that then negatively impact our cholesterol. So remember to keep a wide open view. And stress affects sleep, and sleep affects inflammation. Again, we've got to look at the whole holistic picture. So we all know Albert Einstein, one of our favorite mentors. And here's what he says: everything should be made as simple as possible, but not simpler. I know you have heard, I've been one of those providers, the media, doctors, nurse practitioners, TV, they say all the time, lifestyle works, manage stress, eat better. It seems so simple. And it really is. But on the same token, it can be difficult without the proper tools. And probably first and foremost, one of those tools is knowledge, because we want to get you on the path to recognize the most powerful technique that you have is not a prescription. It is lifestyle medicine. And that's a lot different message that even we as providers gave our patients, say 10 years ago. And I'm one of those guilty parties who've worked in internal medicine that sent the wrong messages to my patients, but not anymore. So let's understand where our community and our healthcare community often leads us. We kind of whittle heart disease down to something very simple, which is LDL cholesterol, which is one type of cholesterol. And this is sometimes perceived as to be the main target. If I control my LDL cholesterol, life is good, I'll be just fine. But when we look at things holistically, we recognize that this is not necessarily the only target. It's not necessarily the best thing. When we look at one thing, we make it overly simple and think we have one solution. When you have a hammer, not everything is a nail. Hammer being statin, okay? Not everything is a nail. Let me look here and let's see and let somebody in again. Thank you. So we think we have one solution, and all too often that solution is a statin medication because we think it's going to make the entire difference for the patient. Just using the statin, just getting their LDL cholesterol low enough. But this is never going to be the holistic answer that we need to reduce our rate of heart disease and reduce your personal risk. We have got to go beyond that here in the United States of America. So speaking of statins, you guys have all seen that picture. If you remember back to biology class, on the lower right, that is the cell cut in half, and the mitochondria, which is the engine of the cell. I don't know about you, but I remember coloring that picture with pencil colors back in biology. So speaking of statins, let me tie this together for you. Researchers are now learning that mistakes were made previously, prompting we providers to prescribe statins to patients who might not necessarily have needed them. That is not neat, and I am not here to say all statin equals bad. But at any rate, the one size all fits statin thing is a dangerous mistake to make because statins do come with some serious risks. Again, we've got the Krebs cycle and that molecular biology, the bottom right of our screen. The mitochondria is the motor of every single cell in our body, and that is where statins can affect us. Up to 20% of statin users have experienced side effects like muscle pain or damage, aching, high muscle enzymes. Just know statins can also poison your mitochondria and make those mitochondria, the cellular engines, to work less effectively. And energy production in our mitochondrial factor or motor per se, that is the single most important factor in healthy aging and wellness. And statins can introduce, again, a whole host of problems like the muscle damage, potential memory issues, Parkinson's-like symptoms, muscles, aches, and pains. We also now know that statins can increase the risk of diabetes, sit down for this, by about 50%. You also have to treat 50 people with statins to prevent one heart attack and treat 890 people to prevent one death. So that means out of 890 people, I'm going to prevent one death. And that means 889 people out of those 890 are taking stats with perhaps little to no benefit. Again, this talk is not about saying statins are useless. They do have a role. I actually prescribe them in my private practice, but sparingly, to say the least. But the main question is, why are we not, providers and patients, focusing on our lifestyle and subsequently lowering our inflammation? That is the key word and is much more powerful tactic when it comes to prevention. So again, to make sure we're all on the same page and empowered by knowledge. Cholesterol in and of itself, it is not bad. It is actually very essential. Just know that there's different types. And you've heard of the types on this slide before. Bad cholesterol is what is bad for you, but not all types are bad for you. For years and years, we providers, and we taught our patients this, we looked at total cholesterol. Good cholesterol plus your bad cholesterol. And if you're over 200, you have increased risk. But that is really not the whole story. That's not accurate. When you have a high HDL, I call it our vacuum cleaner cholesterol, or our healthy, H for healthy cholesterol. If your HDL is high, it can throw you above 200. What a great place to be, because if your HDL is high, that's actually protective. The same token, you should not feel safe if you're below 200 in some situations, because some people have severely low HDL, which again is our good vacuum cleaner cholesterol, and that's a huge risk as well. So the key to remembering, L LDL equals lousy, H equals happy, healthy, helping cholesterol. I liken it to a vacuum cleaner, and T is for terrible triglycerides. So that's a simplified way. You guys, if you're on this talk, I bet you've heard of those three terms because that's what we providers have been aiming at. But here is what I want you to move on to. Here is the big shocker. And here's the big statistic that knocked me off my rear end, and tie it to the slide about statins. Drum roll, please. 50% of heart attack victims had cholesterol at goal when they had their heart attack. They had normal, quote unquote, cholesterol. So here I am in traditional medicine going, so why am I working so hard to bring this LDL, bad cholesterol number down, if 50% of my patients get into desirable range, and they're still going to have a heart attack? It doesn't really seem like a wonderful target, does it? So the scientific brain, as a provider, thinks, wow, well, maybe I'm picking the wrong target. Maybe I have to look at cholesterol, but maybe I have to look at a lot of other things. So I want you, if you have any take-home message today other than most of our risk is modifiable, here's the other thing. Be shocked enough by this statistic that 50% of people with an MI, myocardial infarction, had normal cholesterol levels. Again, I love this gal's face. Maybe we need to look at cholesterol, but maybe we want to look at a lot of other things as well holistically. So we learned about garden hoses as our blood vessels and volcanoes erupting or not erupting. So now we're going to talk about water balloons. So when you have your garden hose, and we're thinking about our garden hose as a blood vessel, you have these little water balloons floating around inside of the garden hose, and they are all different sizes. Your water balloons are actually a better indication of your risk. They tell us a little bit more about what is actually going to hurt the lining of your garden hose or your blood vessel. What's inside of the balloon is water. And even though we have a sense of the kind of water in the balloon, water being cholesterol, it's not going to give as much information as looking at the water balloon itself. I know this sounds kind of crazy. So I can look at a bucket of water and I'm really not going to know how it's going to hurt me until I know the size of the water balloon that water is going to go into, or what kind of water balloon the cholesterol is in, and then how forceful that water balloon is going to come at me. Boom. I hope that concept makes a little bit of sense. So the big picture here is learn about water balloons or lipoproteins, not just the water or the cholesterol inside. I hope that makes sense to you guys. When we want to learn about our risk, most of our attention historically has been placed on cholesterol, aka water. Cholesterol is like the water inside the balloon, but there is another particle we have to look at called lipoprotein, and it is more representative of the water balloon itself. And yes, there are actual tests that help us learn about this lipoprotein particle better. We're going to touch upon that. So again, this is a picture of one of those water balloons. You can see it's complex. There are many things inside. There's different components, triglycerides, attachments. It's what's going on inside that is going to determine how much that lipoprotein or water balloon is going to want to cause plaque inside the blood vessel or garden hose. So when we look at a standard cholesterol panel, and I know you've seen this before, there you go, total, HDL, triglycerides, and LDL. You're familiar with those numbers. So what we get is information about the cholesterol, what is inside the balloon. Yes, that is helpful to some degree, right? Just remember, when we look at the LDL-C or LDL cholesterol, it's not getting us particle information. It's not getting us water balloon information. Incidentally, on this patient's cholesterol profile, especially if this patient's a female, and I don't know, I wouldn't necessarily like this cholesterol profile because again, my vacuum cleaner, healthy, happy cholesterol, the HDL cholesterol at 58, I like females above 60. Males, I'll cut them some slack. They can do 50 or 55. But at any rate, I would not put this patient on a statin. This patient needs to be talked to about many other things rather than a statin first. There's many, many other steps first. So remember, with standard lipid panels, you're only looking at water/cholesterol inside of our water balloon itself. LDL cholesterol does not give us true LDL particle numbers. So what are we supposed to do about that? Water balloons better reveal our risk again. So we need tests that would reveal this, and luckily we have those panels. Your practitioner can work with you to help you answer, is this the right test for me to further assess my risk? Is it the right thing for me so I don't have to be that shocking statistic in the future? My cholesterol is normal, but yet I have a heart attack 50% of the time. There is something called an NMR lipo profile. It's $100 covered by Medicare, most private insurances. It measures LDLP, which is a direct measure of low density lipoprotein particles. The causal link between high levels of LDLP, P for particle, and development of cardiovascular disease that is well established in the literature, in the science. Studies have demonstrated that per particle cholesterol amount varies in patients with type 2 diabetes, with patients that are treated by statins, and those that definitely have cardiometabolic risk factors like high blood sugar and obesity. So here's a picture of many of our water balloons or particles. So from left to right, VLDL, VLDLR, that's an intermediate density lipo particle. SD, small density LDL, those are the little red ones on the far right. Small dense LDL, these are the ones that like to burrow in that lining of our garden hoses or blood vessels. Do we have big bouncy blue particles to the left, or do we have those BB small dense red ones to the right, which are definitely more of the troublemakers that again like to burrow? We have to look at our water balloons to get a better sense and remember all the factors that lead to a volcanic eruption that we're trying to prevent. We have to put them all together and get the full picture of what is our risk factor for cardiovascular disease. So particle type matters. So take a big breath because the next slide is much, much more complicated as we try to tie this all together. Let me see if I got my slide correctly placed. There we go. So again, this kind of brings together garden hoses, volcanoes, and water balloons. It's the pinnacle of what we're trying to understand with this talk and how we develop atherosclerosis, meaning fancy word for heart disease, or when we think of the vessels of the brain, brain disease. So you look at that blood vessel again, the inner lining, we can see the same thing here. The yellow lining coming up over that lipid core, it kind of slopes upwards towards the right, up over the surface of the mountain. Remember, this could be a vessel feeding your heart or your brain, stroke versus heart attack. We want to make sure that vessels throughout our body are healthy and prevent a chain reaction from going on. So recap with me so we understand what the process is. Number one, when we have damage to that inner lining of our garden hose blood vessel, that's the first pivotal step that starts cascade of events leading to a volcanic eruption. What damages that lining? You've heard of these before, refined foods, high blood sugar, hypertension or high blood pressure, and stress, eating the wrong foods, trans fats. Did I say stress? I should say it again. Those things set up a process that damage the inner lining of that blood vessel and making it leaky. So now intruders can come in. That is step one. Step two, this is where you think of LDL particles or atherogenic particles coming through the leak. When they come inside, they break barriers. Your immune system is activated. That's that upper little square on the right. The immune system is triggered and it wants to separate those nasty atherogenic particles. So it triggers monocytes to kind of be the escort. Monocytes escort those atherogenic particles into the lipid core because remember, they want to separate it and wall it off and sneak it away and store it away. That's called oxidization and burrowing. That's step two. Thirdly, again, goal, this wouldn't be happening at all. But at the very least, we want to store after oxidation. There's the storage phase, and you can see gooey plaque starting to form. That's a combination of unhealthy lipoproteins mixing with those immune cells, monocytes, and making a gooey center. That's that necrosis circled there. Although there is a gooey center there, when you have got an intact fibrous plaque that walls things off, this is considered a stored stable plaque. But boom, number 4, if the fibrous cap is compromised, if it's not compromised, it's a stable plaque. But if it's compromised and you've got inflammation on the side with that gooey wall, the gooey stuff, factors from the outside, inside of the, from the outside that are damaging, there's slow wear and tear on that fibrous cap, and that's what leads to eruption. So again, it's kind of working both ways, things in our bloodstream, as well as what's going on in the gooey, ooey mist, where it says necrosis on the inside. This is what we call an unstable plaque that erupts. So when it erupts, again, think back to that piping at the beginning of the talk. The body wants to stop it and clog it and wall it off. So the body sends a bunch of platelets, other materials to block the leak that's occurring. That's when you get a platelet thrombus or clot to block the hole, okay? So then we've got, that's called heart attack, that's called stroke, an unstable eruption. So again, you've got this figured out already. Here's our actual blood vessels. Real prevention should be focused on stopping the cascade of events that you see on the bottom of the slide, getting the vessel on the left to at least stay stable, or at least minimizing it, getting healthy cholesterol to clean up that lipid core, keeping it sequestered. The goal is to keep from going to the eruption and looking like the vessel on the right. So here's a slide that you want to carry to your provider. When your practitioner recommends an advanced prevention test for you, they will be looking at these type of markers related to inflammation. They'll be looking at these water balloons, particles, apolipoprotein A1, B, E, fibrinogen. This helps them look at the health of your blood vessels, and they can better understand what your true risk is, target it early and not waiting for the eruption to take place. Once the eruption occurs, we're pretty limited. That's called going to the cath lab for a stent, putting the person on aspirin, et cetera, et cetera. We want to do things in advance. Again, you probably recognize one of these particular markers that is quite popular, HSCRP, high sensitivity C-reactive protein. It is a marker of inflammation that tells us if there are things going on in that blood vessel and it can signal that there's an upcoming volcanic eruption, okay? It's a measurement of inflammation. Remember that your provider may also be interested in assessing whether or not you have insulin or blood sugar or blood pressure issues. That is also part of an advanced look of prevention, prevention markers for heart disease. So again, we recognize lifestyle is the key. If you have a poor lifestyle and you mix it with your genes, of course, you have a higher risk for disease and you have a poorer quality of life. Notice when I say you mix the two. Again, I think we've done a lousy job of messaging. We used to say, you know what, your cholesterol is all genetic, and a lot of it is. A lot of it is. But the bottom line, it's simple math when it comes to mixture. Lifestyle is actually 80% of that mixture, and our genes only about 20%. We have been led by providers way back like myself to believe differently, that genes determine our fate. Yes, they complicate things. Yes, they make some of us have to work harder, but no, they do not determine our fate. The power is if we can eat the right way, move better, manage our stress. How many times do I need to say that one? Sleep better. We will have less disease, less risk, and less quality of life. This is the same thing, simple math, different words. There's good, there's bad. Either or, you're asking for more or less disease by the way you live. So here's some steps to start the path to healing no matter where you stand. This may be primary prevention, where you have not had a quote unquote event, or you may have had a heart attack or stroke and you do not want it to happen again. Maybe you're already on a statin. You by no means should abruptly stop a statin. That is something a provider can help you do, perhaps looking at a lower dose, et cetera, that we'll cover that a little bit later. At any rate, these steps apply to primary prevention or if you've already had an event. Number one, you want to assess your personal risk. Your provider can help you here. We already looked at a slide that had all kind of advanced markers to look at. Then you want to set personalized targets. No one magical number fits all patients, whether it's their weight, their blood sugar level, their insulin lipids. Your targets are as beautifully unique as you are. Once you set your targets, you start lifestyle medicine. There are ways to track your progress and see if your efforts are working. Again, we want to make it a lifelong plan and something we are able to manage and maintain, not something that we do for 3 or 4 months and then say to heck with it and quit, because your numbers, your particles, your weight, your sugar will return to where it's most comfortable at, especially if you've got the unfortunate right genetic or the wrong genetic key to kind of trend that way. It has to be a lifestyle that we're committed to. And there are even just small changes can make differences. What are some choices? And here are 4 to go into detail. Obviously, I'm just touching upon them today. Obviously, in my private practice, I talk to patients about these every day. They don't like me. I admit personally, we all struggle with implementing these changes. At the pharmacy on a daily basis, we talk to people about food plans. What are some supplements? Always start with diet first, and that's what these slides are aimed at today. We want to increase our dietary fiber. We want to incorporate plants of all color, and guess what? That's not once a week. I should eat green, red, purple every day. We want to use healthier oils when we cook, primarily coconut oil, perhaps extra virgin olive oil, cold pressed. We want to be liberal in using healthier fats. We want to cook with coconut oil. We definitely, another take-home message, eliminate trans fats, okay? Fiber is so very important. I prefer getting my patients to getting it the way nature and God intended for us to get it, through whole food, whole grains, beans, veggies, roughage. If we eat colorful veggies, we also get the added benefit of phytonutrients or plant nutrients. The more color you have, each one of those colors has specific healing capacities, and we want the rainbow effect. A woman needs to get at the very least, and I'm setting the bar low here, people, 25 grams of fiber a day. A man, at least 15 grams of fiber per 1,000 calories. So I generally, for my patient population, will set the bar higher, but these are basics. I don't want to scare anybody off during this talk today. Again, a bar that is labeled a fiber bar that has chocolate over it may not be the right choice. Real food that looks like food is always going to trump a fiber bar that's packaged quite fancily with the chocolate covering. We want to go for the good fats. In the 1980s, back in the pasta diet days, we thought all fat was evil, but that is incorrect. As many things that we did in the 80s were incorrect. There is good fat and there is bad fat. Obviously, good omega-3s include something like salmon. That's a good source. Again, there's extra virgin olive oil, cold pressed coconut oil. These are small things you can do to start transitioning. Here is where I am the enemy of any native Texan. We want to go light on dairy and meat. You know, I'm from Lavaca County, the cow, and we eat far too much red meat here in South Texas, here in the United States, really in general, but Texas, we're really bad on this, right? Theoretically, we should have meat on special occasions. I'm talking in a perfect world like Southern Italy, where it's a blue zone. Those folks have red meat maybe once, twice a year. On the flip side, they have fatty fish once a week, twice a week. I'll try to get our patients here, man, if we can just go for red meat twice a week, that is an improvement. Dairy and meat, the reason why we have to watch them, they often have more saturated fats than we need. That does not mean that we need to avoid all saturated fats, but just know that too much on the saturated fat side contributes, saturated fat side contributes to those volcanic eruptions. One thing we all know here, we have to get rid of all trans fats. Again, trans fats are similar to saturated fats. They in the way that they do increase your LDL lousy fats, but they're a double whammy. Saturated fats at least have the potential to increase our healthy HDL, the vacuum cleaner cholesterol, but trans fats not only increase your LDL and the particles, the lipoproteins, but they also reduce your HDL, the good stuff. So look at labels. So we can start by this one. You can see trans fat. Okay, that looks pretty good. 0 grams. That's the first layer of checking for trans fats. But take it a bit farther. So here is this pie that I'm not going to let myself eat this weekend, and I did not eat on Super Bowl Sunday. You look, trans fats, that looks benign enough. Okay, 2.5 grams. Can't do it. Nope. But then we look at another label. On the right side, it says trans fats, 0 grams, but beware of marketing. Again, the label on the left, that kind of hits us, okay, 2.5 grams, we're not going to do that one. But we look on that label on the right, we go, oh, okay, trans fat, 0 grams. What happens is it's fancy marketing. Many times on these processed foods, they will keep that trans fat just below the threshold of reporting. But then you look into the ingredient list, hydrogenated oils. See where that's listed? That is a code word, fire siren for trans fat. So if you see it in the list, this is not a wonderful product. We need to avoid it because it's going to feed that volcanic eruption. Again, wisdom. Wisdom is information we put into practice. The first step is risk assessment, and we want to give you the tools and knowledge for you to work with your practitioner to find your best health and to start by getting a risk assessment so you can set your goals. And you can see a standard cholesterol profile is not going to give us all the information that we need to adequately reduce our risk. So that's a heck of a lot of information. Let me put my, let me put my camera back on. There, I'm back on, forgive the glare. And let me make sure, please feel free to shoot me some questions. Let's see, ask all to unmute. So does anyone have any questions? You should be able to unmute yourself. And yeah, so feel free to ask questions, and let me open up my chat box because I can also look if it sent some questions over the chat box. I have a quiet crowd.
Does chicken fall into the red meat category?
That's a great question. No, but be very careful. But be very careful because you're going to need expensive chicken, which is organic without being loaded with hormones.
Okay.
Because then you get hormonal disruption. And that's another talk in and of itself. And hormonal disruption leads to inflammation.
Okay.
I always get so excited because there are many, many tools that I did not know about in internal medicine to help folks manage their cholesterol. Obviously, there's also now new tools to measure their cholesterol, the particles in a different way. What makes me sad, though, is not that statins are bad. It's just there are so many steps missed before them. And granted, statins do have a role to play. Statins have a role to play in a particular population. But you guys remember that cholesterol profile during these slides. That person is by no means a candidate for statins. There are many, many interventions. Food is an intervention, sleep is an intervention, stress management. Then you have nutraceuticals or supplements, pharmaceutical supplements like a quality fish oil, doesn't have to be krill oil, but a quality fish oil. You've heard of niacin before. That's one. You got to be careful. It can raise blood sugar. You've heard of red yeast rice that works similarly to statins with a little more friendly side effect profile. There's a botanical called bergamot. There's plant sterols. There's a supplement called Berberine that's quite effective for cholesterol as well as blood sugar reduction. So again, I get all fired up. There are so many wonderful tools to use before we think about adding that statin. On the same token, a message that I do want to impart to you today is if you're on a statin right now, should you cold turkey it? No. That is a process. Again, you have to look at a patient's genetics, their risk factors, their particles. Have they had a past event? Maybe they haven't. Maybe they're good to go on all those. I still wouldn't cold turkey it. I would taper a person down. Again, that is something that you do with your provider's assistance. Man, I had a lot of great folks. Did everybody get the slide deck?
Yes.
Awesome. And you have my email on there. You can shoot me questions via email. Sometimes I answer those late at night or the next day. Forgive me, sometimes I'm a little tardy, but always feel free to shoot questions because Steve and I want to be a resource for folks. It really does all start with lifestyle management. And sometimes it's just making a few changes. I've had the typical patient who cut out soda water or sweet tea and their weight decreased and so did their blood sugar. And that positively impacted their HDL or healthy good cholesterol. So there's some even small lifestyle tweaks to make. It doesn't need to be overwhelming. We don't want to scare patients off.
A lot of good information.
Yeah, it's really good information. I changed my slide deck last night about 9 o'clock. My husband was not very happy with me because I just like these slides a lot better than the ones I was using. But of course, that increased my stress level, which I'm preaching to you guys, has a definite negative impact on our volcanic eruptions and our garden hose / blood vessels and our overall inflammation. It's a whole different lingo than it was when I first started as a nurse practitioner in 1999. Inflammation is a huge factor, and it explains why 50% of people have quote unquote goal or normal cholesterol and they have a heart attack. 50% of all people that have had a heart attack, their cholesterol is goal / normal. So what else are we doing to help these folks?
When you say inflammation, you're basically just talking about the slide where it shows the buildup. Is that which is the term when you use the term inflammation?
It's a great question. When I use the term inflammation, I'm talking about really what's going on with that lipid core, both from within, because food and stress, lack of sleep can impact that lipid core from within. But when we are inflamed, and this is where gut health, and they're learning more about how gut health is tied to cardiovascular health. But when gut health is poor, you've got more inflammation in the bloodstream that's running through that garden hose. So that lipid core it's being hit from both ends, for lack of better words. It's the blood going through the vessel, but it's also inflammation within that lipid core, and that immune system response on that really complicated slide where the immune system starts sending out monocytes to kind of sequester those bad atherogenic particles. That's inflammation. That's an immune response.
Okay.
So it's really kind of double-ended, two-sided.
One more question.
Good.
I've been reading about bone broth and the benefits of it because of collagen and stuff. Would that be a negative? Would that have a negative effect on what we've been talking about?
Not at all.
If you take a lot of or drink bone broth?
No, it should actually have a positive effect. It should actually have a positive effect because of its positive impact on gut health with the goal of inflammation reduction.
Okay.
Yeah. So we talk a lot. This will be Cherise's shiny squirrel brain veering off the path. We talk a lot about having 2, maybe 3 bowel movements, soft and well formed every day, and no bloating, no indigestion. Proton pump inhibitors are not our friend. That's an entire other talk, but gut health is related to cardiovascular health.
Okay.
Would folks like a recording of this if I'm able to figure out the technology?
Yes.
Yes, I would.
Okay. Yep. I will see. I make no promises, but I'll do my best. I think I can figure that one out. If not, I'll ask my marketing folks at Help Central Drug. Did it make sense?
For
Yes.
sure.
Okay, good. I liked the way they put on these slides. I do like the garden hose volcano analogy a lot because it helps you understand really that it's not just a big glob of fat that clogs our pipes. There's a lot more action going on.
Yeah,
Yep.
for sure.
Yep. Okay. Thank you, ladies and gentlemen. I appreciate you guys joining me today. I am going to bounce off, and I'm going to actually, before I bounce off, I will put my email again in the chat box so you can feel free to shoot me questions. And I encourage you to do so. We want to be a resource here at Central Drug. We love it when people stop by. We do social distancing and wear masks, but that human interaction does nice things for reducing our stress levels. So always feel free to come by for a pharmacy consult. If you want to know some different things that maybe you can do on how to look at your risk, or you can do lifestyle wise, we've got some great food plans that are that you can implement, a great lifestyle app. We've got a lot of cool tools to spread the word. Okay.
That's good. Thank you.
A lot of fun.
Thanks, Cherise.
Guys, thank you.
Thank
Thank
you.
you.
I hope to
Appreciate
see
it.
you guys soon. Take care, okay?
Okay, bye-bye.
Bye-bye.